Cartilaginous joint between adjacent vertebrae, vertebral column, ball and socket joint between humerus and pectoral girdle, fibrous joint between flat skull bones, and saddle joint between carpal and metacarpal of thumb. Correct statement regarding skeletal muscle. Sarcoplasmic reticulum of muscle fiber is a storehouse of calcium ions. Striated appearance of skeletal muscle fiber is due to distribution pattern of actin and myosin proteins. Muscle bundles are held together by collagenous connective tissue layer called fascia. Muscle bundles are called fascicles. The portion of myofibril between two successive Z lines is considered as functional unit of contraction between sarcomere. According to the sliding filament theory, length of a band does not change. Explanation: in sliding filament theory, skeletal muscle shortens during contraction because the thin filaments actin slide past over the thick filaments myosin. Thus, the I band gets reduced and the A band retains its length. As the thin filaments slide inwards, the Z discs come close together and sarcomere shortens. GORD is a type of disorder which leads to inflammation of joints due to accumulation of uric acid crystals. GORD is a metabolic disease caused by increased production of uric acid and deposition of uric acid crystals in the joints, leading to inflammation of the joints. Assertion and reason. Assertion: osteoporosis is characterized by decreased bone mass and increased chance of fracture. Reason: common cause of osteoporosis is increased levels of estrogen. Assertion is correct and reason is incorrect. Reason is incorrect because osteoporosis is due to decreased levels of estrogen. Osteoporosis is an age-related disorder characterized by decreased bone mass, hence the chances of fractures increase. Which of the following is the correct match for disease and its symptoms? Arthritis, inflamed joints. The correct answer 1 is correct answer because arthritis is inflammation of joints. 3 is incorrect because myasthenia gravis is an immune disorder affecting neuromuscular junction leading to fatigue, weakening and paralysis of skeletal muscle. Option 4 is incorrect because muscular dystrophy is progressive degeneration of skeletal muscle, mostly due to genetic disorder. Option 2 is incorrect because tetany is rapid spasms in muscle due to low calcium in body fluid. Which of the following is present between adjacent bones of vertebral column? Answer: cartilage. Option 2 is correct answer because cartilage forming the intervertebral disc is present between the adjacent bones of the vertebral column and it is a type of cartilaginous joint. Option 3 is incorrect because areolar tissue present beneath the skin is a type of loose connective tissue. Option 4 is incorrect because smooth muscles are present in the visceral organs. Option 1 is incorrect because scalated discs are characteristic feature of cardiac muscles present in heart. Chronic autoimmune disorder affecting neuromuscular junction leading to fatigue, weakening and paralysis of skeletal muscle is called as answer myasthenia gravis. Option 3 is correct because myasthenia gravis is a chronic autoimmune disorder affecting neuromuscular junction leading to fatigue, weakening and paralysis of skeletal muscle. GORD is caused due to decomposition of uric acid crystals in joints leading to its inflammation. Inflammation of joints is commonly known as arthritis. Muscular dystrophy is a genetic disorder which results in progressive degeneration of skeletal muscle. Scapula's shoulder blade is a triangular flat bone of the pectoral girdle located on the dorsal part of the thorax. Cranium is made up of flat bones that fuse end to end with the help of dense fibrous connective tissues. These joints in the cranium do not allow any movements and are called fibrous joints. Sternum, also called breastbone, is a flat bone on the ventral midline of the thorax. The joints between the adjacent vertebrae in the vertebral column are an example of cartilaginous joints. As these are joined with the help of cartilage, these joints permit limited movements. During muscular contraction, which of the following events occur? H zone disappears, I band reduces in width, myosin hydrolyzes ATP releasing the ADP and P and pi. Z line attached to actins are pulled inwards. The correct option is 1 because the length of A band is retained during muscular contraction. The following events occur. The globular head of myosin acts as ATPase and hydrolyzes ATP molecule and eventually leads to the formation of cross bridge. This pulls the actin filament towards the center of A band. The Z line attached to these actins are also pulled inwards, thereby causing a shortening of the sarcomere. The thin myofilaments move past the thick myofilaments, due to which the H zone narrows. This reduces the length of I band but retains the length of A band. The myosin then releases ADP plus PI and goes back to its relaxed state. Floating ribs do not connect with the sternum. Acromion, clavicil, scapula located between second and seventh rib. Glenoid cavity, head of the humerus. 11th and 12th pair of ribs are not connected ventrally and therefore called floating ribs. Acromion is a flat expanded process of spine of scapula. The lateral end of clavicle articulates with acromanian process. Scapula is a flat triangular bone in the dorsal part of the thorax between second and seventh rib. Glenoid cavity of scapula articulates with head of the humerus to form the shoulder joint. Gliding joint between the carpals, hinge joint between humerus and ulna, pivot joint between atlas and axis, saddle joint between carpal and metacarpal of thumb. Select the correct option. There are 7 pairs of vertebrosternal, 3 pairs of vertebrochondral, and 2 pairs of vertebral ribs. Explanation. Vertebrosternal ribs are true ribs. Dorsally, they are attached to the thoracic vertebrae and ventrally connected to the sternum with the help of hyaline cartilage. First 7 pairs of ribs are called true ribs. 8th, 9th and 10th pairs of ribs do not articulate directly with the sternum but join the 7th ribs with the help of hyaline cartilage. These are vertebrochondral or false ribs. Last 2 pairs, 11th and 12th, of ribs are not connected ventrally and are therefore called floating ribs. Only first 7 pairs of ribs are ventrally connected to the sternum. Name an autoimmune disease. Myasthenia gravis. Which of the following muscular disorder is inherited? Answer: muscular dystrophy. Explanation: progressive degeneration of skeletal muscle, mostly due to genetic disorder, is muscular dystrophy, whereas tetany is muscular spasm due to low calcium in body fluid. Myasthenia gravis is an autoimmune disorder leading to paralysis of skeletal muscles. Botulism is rare and dangerous type of food poisoning caused by bacterium Clostridium botulinum. Which of the following is not an autoimmune disease? Answer: Alzheimer's disease. Explanation: rheumatoid arthritis is an autoimmune disorder in which antibodies are produced against the synovial membrane and cartilage. Vitiligo causes white patches on skin, also characterized as autoimmune disorder. Psoriasis is a skin disease that causes itchy or sore patches on thick red skin and is also autoimmune, whereas Alzheimer's disease is due to deficiency of neurotransmitter acetylcholine. Which of the following hormone can play a significant role in osteoporosis? Answer: estrogen and parathyroid hormone. Estrogen promotes the activity of osteoblast and inhibits osteoclast. In an aging female, osteoporosis occurs due to deficiency of estrogen. Parathyroid Path hormone promotes mobilization of calcium from bone into blood. Excessive activity of path hormone causes demineralization leading to osteoporosis. The pivot joint between atlas and axis is a type of synovial joint. Out of X pairs of ribs in humans, only Y pairs are true ribs. Select the option that correctly represent values of X and Y and provide their explanation. X equals to 12, Y equals to 7. True ribs are attached dorsally to vertebral column and ventrally to sternum. Name the ion responsible for unmasking of active sites for myosin for cross-bridge activity during muscle contraction. Answer: calcium. Calcium ion is responsible for unmasking of active sites for myosin for cross-bridge activity during muscle contraction.